Why are Yorkies so susceptible to hip and joint problems? Well, a lot of it comes down to their genetics and delicate bone structure. Conditions like Ledge-Calf-Perthes disease are surprisingly common in small breeds. This sounds complicated, but it's basically a condition where the head of the femur, that's the ball part of the hip's ball and socket joint, doesn't get enough blood. This causes the bone to weaken and fracture over time, leading to pain, limping, and arthritis. Another big one is patellar luxation. This is a fancy term for a dislocated kneecap. In Yorkies, the groove that the kneecap is supposed to sit in is often too shallow, so it can easily pop out of place. You might notice your Yorkie suddenly skip a step or hold a leg up for a moment before going back to normal. While it might not seem like a big deal at first, over time, this can lead to cartilage damage and arthritis. And of course, like many dogs, they can also develop hip dysplasia, where the hip joint doesn't form correctly, causing instability and pain. The good news is, there's a lot we can do. Prevention starts from day one. When you're choosing a puppy, it's so important to go to a reputable breeder. A good breeder will screen their dogs for genetic conditions like hip dysplasia and patellar luxation and will be transparent about the health history of their puppy's parents. This is your first line of defense. Next up is weight management. This is absolutely critical for Yorkies. Even an extra pound can put a huge amount of stress on their tiny joints. Think about it, that extra weight is like them carrying a heavy backpack all day, every day. It accelerates the wear and tear on their cartilage. So, make sure you're feeding a high-quality, balanced diet and sticking to the recommended portion sizes. Resisting those puppy dog eyes when they beg for table scraps is tough, I know, but it's for their own good. A lean Yorkie is a healthier Yorkie. Exercise is another key piece of the puzzle, but it's about the right kind of exercise. Yorkies are energetic, but their joints can't handle too much high-impact activity, especially when they're young and still growing. Avoid letting them jump from high places like couches or beds. This can cause serious injuries. You can get little pet stairs or ramps to help them get up and down safely. Regular, low-impact exercise like daily walks or gentle playtime on a soft surface is fantastic. It helps build strong muscles around the joints, which provides extra support and stability. Think of those muscles as a natural brace for their hips and knees. Swimming is another excellent, no-impact exercise if you have access to a safe place for them to paddle. Supplements can also play a huge role in proactive joint care. Even before you see any signs of trouble, you might want to talk to your vet about starting a joint supplement. Glucosamine and chondroitin are the most well-known. They are building blocks for cartilage and can help keep it healthy and lubricated. Omega-3 fatty acids, often found in fish oil, are also fantastic because of their anti-inflammatory properties. They can help reduce any low-grade inflammation in the joints before it becomes a bigger problem. Think of it as an insurance policy for their future mobility. But what if, despite all your best efforts, your Yorkie starts showing signs of joint pain? Maybe they're slowing down on walks, having trouble getting up, seem reluctant to jump or play, or you hear a little clicking sound when they move. The first and most important step is to see your veterinarian. Don't try to diagnose it yourself or just wait and see. Your vet can do a physical exam and may recommend x-rays to get a clear picture of what is going on inside those little joints. Getting a proper diagnosis is crucial because the treatment will depend entirely on the specific problem. If the diagnosis is something like patellar luxation, the treatment can range from conservative management to surgery. For mild cases, where the kneecap only pops out occasionally, your vet might recommend a plan similar to our prevention strategy: weight management, controlled exercise, and anti-inflammatory medications or supplements. Physical therapy can also work wonders, helping to strengthen the specific muscles that hold the kneecap in place. However, for more severe cases of patellar luxation or for conditions like Ledge-Calf-Perthes disease, surgery is often the best option to relieve pain and restore function. For Ledge-Calf-Perthes, the typical surgery involves removing the head and neck of the femur. Now, that sounds drastic, I know, but small dogs do incredibly well with this procedure. A false joint made of scar tissue forms, and most dogs are back on their feet, pain-free, living a completely normal and happy life. For severe hip dysplasia or patellar luxation, there are various surgical techniques to correct the alignment and stabilize the joint. Your vet or a veterinary surgical specialist will walk you through the best option for your dog's specific situation. After surgery, or for managing chronic conditions like arthritis, post-care and long-term management are key. This is where you really become your dog's personal nurse and physical therapist. Your vet will give you a detailed plan, which will likely include pain medication, strict rest initially, followed by a very gradual return to activity. This is where rehabilitation therapy is a game changer. Things like underwater treadmills, therapeutic exercises, and even acupuncture can significantly speed up recovery and improve long-term outcomes. At home, you can make some simple modifications to make your Yorkie more comfortable. Orthopedic beds provide great support and cushions for joints. Using raised food and water bowls can make eating and drinking more comfortable, as they won't have to bend their neck and back as much. Keep your home warm and draft-free, as cold and damp weather can make arthritis symptoms worse. And don't forget the power of gentle massage. It can help soothe sore muscles and improve circulation. With the right care, management, and a whole lot of love, your Yorkie can continue to live a full, happy, and comfortable life. I hope this was helpful for all you Yorkie parents out there. If you have any experience with these issues, please share your stories and tips in the comments below. Your experience could help someone else going through the same thing. Thanks so much for watching. Don't forget to like and subscribe for more pet care tips, and we'll see you in the next video.